Okay, so welcome back to the weekly well-being deep dive. This is a place for anyone who is ready to conquer chronic illness to learn more and hopefully get some tips and keys to help them move on to their next level of well-being, because there's really no limit to how healthy we can be, and all of these things that people struggle with, like depression and fibromyalgia and chronic fatigue, digestive stuff, any autoimmune disorders. They all do actually have a cause. And I love helping people find the cause so we can address it and move on in our health. So today's topic is about depression. And if you read my newsletter, it said depression and anxiety, but as I got into doing a bit of research, it was just too much. And I've never thought that those two go that well together. They do have similar causes, but I think they're best to address separately. So in my research, I learned that depression is a leading cause of disability in the US. The guy thought he said it was anywhere from the leading cause to within the top three. And it is often associated with other disorders. So any other chronic illnesses or autoimmune disorders, depression is often a piece of that. And the other thing that he said, and this was like some leading MD at, oh, I forget what university, but anyway, this is his field. And the other things he said is that there's no known cause, which I thought was really interesting, because when I look at blood work, it seems like there's a lot going on in people who have depression. So that's why I asked this question. Is it a mental and emotional thing, like the symptoms would indicate, or is there more to the story? So some of the most common symptoms, there are tons and tons of symptoms associated with depression, but these are some of the most common. So low or depressed mood, fatigue, irritability, change in the appetite, too much sleep or too little sleep, and then feelings of worthlessness and hopelessness. So not a place that anyone wants to be. And another thing was like thoughts of suicide, and I feel like that's a whole other discussion and something that I would love to contribute to preventing. Let's look at some blood work from someone who was diagnosed with depression so we can maybe find some causes here. So this is a typical blood panel of someone who has depression. I kind of put together a few of my clients that have been diagnosed with depression and what their blood work typically looks like. And it's fairly consistent. In addition to this page, there's also the vitamin D. Vitamin D is almost always really low with people who have depression. And I think that's pretty telling, because vitamin D and iron are two of the things that you need in order for your cells to make energy. And it's hard to have much positivity if you don't have energy. So I thought this blood work was really interesting. This is just the complete blood count with the differential. So the complete blood count, WBC is white blood cells, RBC is red blood cells. These next parts, hemoglobin, hematocrit, and so on, these all kind of have to do with the red blood cell count. MCV, it's like mean corpuscular volume, like stuff that doesn't mean a lot for most people. But there are some things that they indicate. And then these last five on here, these are the different types of white blood cells, and those are the ones that indicate infection. If we jump back up here, the total white blood cell count is low, and that's an indicator that there's some infection going on. A lot of the red blood cell indicators were low, which is an indicator that these people need iron. So right off, we've got vitamin D and iron being low and infection being present. This MCV being high, that's an indicator that B vitamin methylation, which is basically just using the B vitamins. B vitamins help with mood and energy and stuff like that. A lot of us can't use them because of a genetic little tweak that's not quite right. And so some support in B vitamin methylation is something that lots of people with depression need. And then if we look down here, The neutrophils are high, the monocytes are high, and the eosinophils are high, which indicates bacterial, viral, and parasitic infections. And this is so common and with people in depression. I just want to go back a slide and look at the symptoms again. So check out these symptoms: low mood, fatigue, irritability, change in appetite, poor sleep, feeling worthless or hopeless. But look at all that's going on here. They don't have enough iron or vitamin D to make up much energy. Plus, they're fighting all of these infections, and their B vitamins aren't doing much for them. So when your body's fighting off infections, it takes a lot of energy and a lot of attention. And that's all coming from the inside. It's not stuff that you're actually thinking about, but your body is working on it hard. And so, is it surprising that all of these symptoms that make up depression would be happening? Low mood. Well, you don't have vitamin D and iron, which are key for energy and mood. Fatigue. Again, you don't have those. Plus, you're fighting infection. Irritability. Infections cause irritability, especially the parasites, I feel like. Those can make people super irritable. Change in appetite. Again, parasites, other infections, those are all going to affect appetite. Oops, went back an extra slide. Too much or too little sleep. So if you're getting too much sleep, that can also be a sign that there's infection going on if you just can't ever wake up because you don't have enough energy. Also, low vitamin D and iron. Too little sleep, that's often from that irritability, which parasite infection can cause. And all of that together, no wonder you're feeling worthless or hopeless. So, in my view, this blood count can really point to a lot of the potential causes for depression. And if you're someone who has also had, some emotional trauma and stuff like that, plus you've got this going on, I don't think it's very surprising. So I do think there are causes for infection or for depression that we can address. And as any of you who've been here before, I'm all about finding the roots of the problem. And depression does have roots. When we dig up those roots and fix things like vitamin D levels, most MDs don't even want to test vitamin D. A lot of insurance doesn't even cover testing for vitamin D, which blows my mind because it's associated with so many problems in our lives, having not enough vitamin D. And then, so roots of depression can include not having enough vitamin D, which I think some of you have probably heard of the seasonal affective disorder, which is that type of depression that people get in the winter when it's dark. Well, we make vitamin D from sunlight, from getting sunlight on our skin. And in the winter when it's dark, we're not making as much vitamin D. So doesn't that make sense that vitamin D would be a key player here? It's vitamin D, iron, plus infection, all roots of depression that are fixable. And I'm not saying don't stop seeing a therapist or something if you have depression. Therapists are always great to see too, but I think there is more to the story. And it was interesting doing the research in that that guy, the doctor that I was listening to his little spiel, he was like, and medications, they work sometimes. Sometimes they don't work. I don't know. I don't know what's best. It really depends on what type of depression you have. But since we don't know the cause, why are we giving medications? And I was like, well, yeah, why would you give medications if you don't know the cause? But it happens all the time. So I really believe in creating long-lasting internal change, which starts from finding the roots of the problem. And depression, as I've said already, has some roots. And I would love to help people fix that. So if you know of people with depression, this recording will be up on YouTube and you can pass it along. And if you would like to chat with me, this is how to get a hold of me. I do a free consult. And if you have any questions or if you want to see what your blood work says, we can completely look into that. And since I do have someone live here, Lisa, if you have any questions, I'm happy to answer them. Oh, you're muted.
No, I think I'm good.
Okay, great. Well, I hope this was helpful, and I'm not sure which topic I'm going to tackle next week, but maybe I'll do the other half, the anxiety half. But again, there will be another weekly well-being deep dive next Monday at 1 o'clock Eastern time. And all the recordings go to my YouTube channel. So I hope to see you then. All right. Have a great day.
Thank you.